The beauty of another beauty, I like the word beauty, of what I do is being able to sit down with my patients and actually have time to talk to them. The two things that I really value as a primary care doctor is time and trust. Every doctor can do superficial screenings, screenings based on your age, sex, where you live. But what really shows the value of your doctor's skill, knowledge, and their joy of what they do is being able to explain things to you, but also work up things and discover what's going on. But you have to have time to do that. These 5 minute appointments don't really allow time to do that. You can only say so much in 5 minutes. You can only say so much in 10 minutes. Sometimes you have a brain fart and you actually aren't able to explain things exactly as concise as you had practiced it when you were at home. But with direct primary care, you don't have rushed appointments. You have longer appointments. And honestly, if you need a longer appointment, then we just work that out because we aren't stuck with the restricted appointment schedule that's in traditional care. So the other thing with that, so time is one thing that I really value because if I don't have time with a patient, they're not able to tell me things that they're concerned about. They're not able to explain their story and know what's going on. But if I don't have time with a patient, I'm also not able to explain my thoughts and concerns and also educate them on their medical problems. The other thing with that is trust. So if my patients don't trust me, they can't tell me things. If I don't build a rapport, if I don't have time to talk to them, time to explain things to them, time to help them out, then they might not trust what's going on. But trust is not always linked to time. It's also linked to just how I talk to people, how I connect with people. Right now, I'm back home in Flint. I'm a Flint native. I came back home after my training. And so I connect with patients regarding that. I connect mostly with patients because I'm human. Just like they have their challenges, I have my challenges. Just like they have their ups, I have my ups. And we kind of all go through life going through these roller coasters. But one of the great things about being a doctor is I'm able to help people when they're in those highs and those lows. And I hope that my patients trust me to say those their concerns or say their things that they want to kind of look up or wonder more about. It's a beautiful thing to be trusted by a patient, for them to tell you things that they aren't telling anyone else. Honestly, I need patients to TMI me. I need them to tell me too much information because that's when I can say, nope, that's not a problem right now. We'll keep watching it. Yes, that's something that we should be looking into. I know you're not concerned about that, but actually, I think that we should be doing this, or that to see what's going on. So when you casually say something, you have to have those casual kind of references in the conversation with your doctor for them to know that, yeah, maybe I should be looking more into this. So and so said that it wasn't a big deal, but someone else said it was a big deal. And so that's when I'm coming to my doctor to say whatever this or that is something I want to kind of look more into. So time and trust. We need those two things to be great doctors. We need those things for patients to be able to advocate for themselves. And this membership based care allows me to have time with my patients, but also give them the opportunity to trust me with their care. So that way they can be the best versions of themselves, the healthiest versions of themselves, and feel like everything that's going on is being appropriately addressed and managed. Because who wants to have different pains? Who wants to have surprise medical problems in the future? Who wants to have current medical problems unmanaged? No one. So that's the beauty of being a good primary care doctor, is that I'm able to cover people with the concerns they do have right now, but also cover them for the future problems that they might have. I'm a safety net, but also an asset in real time. I really enjoy being a primary care doctor, and through the membership based care, having time with my patients, helping them have affordable, accessible, quality, and convenient care has been amazing. Direct primary care is for everyone. It allows you to step out of the complex health system and really have a simple and comprehensive experience when it comes to your primary care, because we all deserve good care. We all should have the best health uh, access, the best health resources, have the medications that we need, have the food and recommendations and resources that we also need. And so there are a lot of things that go into having a full and maximized quality of life. And when you have a great doctor, which I feel like I am a great doctor, especially now that I have more time with my patients, then you can really have one of the best quality of life and healthiest lives that you can have possible.